So for our last video for this whole class, it is going to be for joint mobilization. So good thing for joint mobilization is trying to get that joint space all nice and loosened up. Sometimes it could be caught. The joint space can be caught on specific structures within the body. Some indications for joint mobilization could be like they're feeling caught or they're not getting enough movement, pain obviously within that joint line. Some contraindications for these joint mobilizations would be if you perform the mobilization and it produces more pain, you obviously don't want to do that. Obvious deformities, fractures, even sometimes if there's good abrasions where you're putting your hands, you may not want to do that. So, well, we're just going to go on with the three that I'm going to do today. So, the first one I'm going to do is for lateral ankle sprains, and most of the time for this one, you're finding that distal fibula, and you're assessing first to see if it's subluxed completely or not, and that's most of the time what lateral ankle sprains can be doing. So, first off, you have them invert, and that would probably hurt, and then I'd return them back to neutral. And then to do this properly, you're going to find that distal fibula, and you're going to push obliquely, kind of back and superiorly, and you want to see that foot kind of move like that, kind of evert out. And then once you've got that pressure there, then you want them to dorsiflex and plantar flex their ankle, and hopefully this would feel better. Let's say it does. So back and forth with that pressure, using your thenar eminence for the pressure on that fibula. And then we'd have them relax, and then we'd do it again and have them invert and evert. Hopefully this will feel better. So you do this about 10 times for each motion, trying to get that fibula that's partially subluxed back into its normal place. And then if this didn't work, we could apply a Mulligan taping technique as well, but I'm not going to show that today. So the next one we're going to do is fifth DIP mobilization, or Mulligan with movement. So DIP is obviously the distal joint. So first off, you're going to block them from flexing their other joints in their fingers and see how the motion is assessed. So let's say that hurts. So then you're going to do it in two different ways. So first off, I'm going to take that distal portion and I'm going to push it medially while stabilizing, and then have him flex. And if that didn't feel better, if it hurt worse, then we'd go the other way. So then I'd be pushing that distal portion laterally while stabilizing, and then have him flex. And if that felt better, that's good. That would be really good. So we do this 10 times on either side, whichever one that would work. And we could also apply a little bit of a rotation aspect. So either rotating it that way or this way. So we'd have him do that, and then bend his finger, and then that way and bend his finger. So those are 4 different ways you can do it for the fifth DIP, all with the same kind of contraindications and indications for joint mobs. So finally, I'm going to perform a medial glide for knee flexion on myself. So it's kind of something that you can do at home if you're having some medial pain. So first off, I'm going to do it right. So you get this assessed. Make sure you have a sturdy table that you can attach this rope that you can. This doesn't have to be a ratchet belt. It can be a bungee cord, something that just gives some good resistance on your outside leg. So you're going to get this assessed. You're going to hopefully have it be pulling your knee and your tibia medially, and you're in this lunge position. So then all you do, you can help yourself here. You just come down and up. You're doing like little squats in that lunge position. and I can feel it pulling my tibia in towards the table, so medially. This could be for anterior knee pain, any sort of knee pain in there. You're trying to just get that kneecap and the tibia back into normal place. So you do this however many times you need to make it feel better. And then yeah, that's it.